11 a.m. How can healthcare workers be better protected on the job? That is a big question state and local leaders are talking about right now after the murder of a visiting nurse in Willimantic. Representative Joe Courtney and the acting U.S. Secretary of Labor sat down with healthcare workers this morning to hear their ideas. And NBC Connecticut's Jennifer Joas was there for that discussion at Three Rivers Community College in Norwich. Jen, that case out of Willimantic was just horrifying and heartbreaking.
It absolutely is, but nurses say, they deal with this constantly, unfortunately, a lot of workplace violence. And so today's discussion was actually focused on OSHA creating nationwide standards on how to address workplace violence, something that can be enforced, that they can hold employers accountable to. And they say because nurses are dealing with violence on a daily basis.
Is actually, unfortunately, a very frequent episode. Being spit on is a very frequent episode that occurs. But then it can also escalate to the point where there's knives and guns coming into the facilities.
So Representative Joe Courtney, U.S. Acting Secretary of Labor Julie Su, and healthcare workers discussed ideas of what requirements could be put in place to make healthcare workers feel safe. Now, some of the ideas included screening for weapons, flagging the patient's chart or color-coding the patient's door if they are violent or aggressive, staff having personal safety alarms to immediately call for help or notify others, and educating nurses and healthcare staff on de-escalation and how to protect themselves in violent situations. The lawyer representing Joyce Grayson, who was killed just a few months ago, was here and also suggested background checks and risk assessments for patients who have home health care workers visiting. And if patients have high scores, providers would be required to take steps in a formal way on how they would plan to protect their workers. On behalf of the family, she also pushed for accountability and follow through to make sure that every healthcare worker knows what they are walking into. Now, Representative Joe Courtney actually proposed a bill on behalf of this in the Senate and the House, we are told. And basically, this would just allow OSHA to create these standards and get them put in place in a sped up process, because typically we're told putting in nationwide standards can take years. Live here in Norwich, Jennifer Joas, NBC Connecticut News. Back over to you.